Hi there, I'm Sean Osterlink, and this is part of a series I'm doing just to share what I'm like as a counselor and my approach to counseling practices. My name is Sean Osterlink, and I'm a Christian counselor, Christian therapist. And I'm going to be talking about treatment goals and treatment planning stuff. I've got instead of my trusty iPad, I'm not going to use it today. I'm going to use something that is clear to see, and that's just going to be having word right here on the screen. Hey, that's pretty neat. I love screen capture. Okay, so the way that I do treatment planning with clients is that usually during the intake session, I try to begin this during the intake, is I'm gathering information, I'm learning more about why a client is coming into therapy, into treatment. Uh, we go over what the problems are. I assess for what those symptoms are, especially if insurance is going to be used. Insurance requires a mental health diagnosis, and so it requires assessing for symptoms in order to determine if there is something there to be diagnosed. Some people opt to do self-pay and don't want a diagnosis. Some people are coming in to work on bettering themselves, on growing in treatment, and they're not experiencing something that's a diagnosable disorder, or maybe they really have addressed those things in their life, and they're just looking for more exploration or growth, things like that. In that case, a diagnosis is not necessarily needed then. But when using insurance, you got to have a diagnosis. So, um, okay, so assess for those symptoms, look at what's going on. Something that I find helpful, sometimes I'll uh, encourage clients to do this as homework, is to create a problem list. And sometimes we'll talk through this in the session, just what are the problems. Usually it's very organic during the intake, but I do find that this is a helpful practice as a homework task. Sometimes I'll even use this in my own life to just go, what are the problems I'm experiencing, or what are the stresses that I'm experiencing? Just that helps me in how my brain works, and they can help tease out like what kind of interventions are going to be useful. How do we need to approach this thing? That way we're staying focused on what this therapy is about. But okay, so treatment goals are about addressing what those symptoms are, what the diagnosis is, especially from, unfortunately, an insurance perspective. If they are the ones paying the bills, then there's something called medical necessity, in which case the diagnosis is part of that medical necessity, and so the treatment is aimed towards addressing that diagnosis in order to bring relief for the client. And so the treatment goals should pertain to whatever that diagnosis is. And yet, treatment goals can certainly go beyond that as well. People come up with all kinds of things as their treatment goals. So I try to have a mix in there. And what I'll do is I'll have the client think of really brainstorm. Sometimes we're doing some of this in the intake, especially towards the end of the intake, once I have a better picture of what's brought people in. But I like to have this also be homework, and then I follow up in the second session where we talk about it further. But really, what would overall progress look like? What would be the overall changes that a client would like to see, in which they envision themselves better from whatever's bringing them in? What would it look like to be on the other side of this thing? Sometimes I use the miracle question. If a miracle happened, what would change in your life? How would you be feeling different? How would you be doing something different? How would you be thinking different? How would you be engaging in relationships different, or engaging in the world in a different way, right? And it's going to be client focused, because I'm working with the person who's in the room, or if it's a couple or it's a family, the people in that room, right? It's not about the goals cannot be requiring other people to change. It can't be requiring society to change. It's about working with the person in the room That's what therapy is about. It's very client focused, is very person focused. It's for the person in the room. So that's how goals. That's how I do goal setting. Is what would that change look like? And so I like to get at kind of general sorts of goals, and this happens to work with our EMR software. So the software that we use to document everything. It has a certain framework, and so I kind of follow that framework as I do this. And so there's general kind of goals, there's problems, like the list out. I put that in the treatment plan, list out what those problems are, list out what those symptoms are. So I'm documenting these things as well. And that helps us keep track of what kind of progress is happening as we work during the treatment. And then there's SMART goals or SMART objectives. And so this is where I think of these as kind of like the goalposts along the way. So we got like the overall pictures of goals, where you would like to be in the long run, because my goal for a client or my goal for my clients is to reach a point where they no longer need me. I want to put myself out of a job. I want someone to get better to the point that they feel like they can fly away and don't need therapy anymore. Sometimes, of course, people are going to need therapy in the future. I view it as kind of akin to sometimes we need to go to a specialist. Sometimes we need to take our car in for a shop. Sometimes we need a professional who's going to do something to work on something in a way that is beyond where our own skills are at. And yeah, this would be like, you know, your car breaks down. The skills necessary to work on it are beyond the skills that you have. You need help, so you take it to a mechanic. But in this case, it'd be that like the mechanic, it'd be like working collaboratively with the mechanic. Like they're handing you tools, and you're working with them to work on the car to the point that, well, now not only have you worked to fix the car in the moment, but now you've got more tools, you're more equipped to work on it in the future. But you could always reach a point in life where maybe you forgot how to use that. Maybe you just um, you're not feeling equipped to work on the same way, or maybe something new broke on the vehicle and now you got to take it in again. So that's how I view therapy is I want to get my people to a place where they're good enough to fly, where you might think of it uh, as reaching a place of you're no longer, if it was like a scale of like a positive 10 to neutral to negative 10. Therapy work is working in that maybe that neutral to negative 10 sort of space. I want to get you up here into where you're more in the positive and you're thriving in life, and then you no longer need treatment. And I do plan on, I've taken some coaching training, so I plan to go into coaching as well, but life coaching. Yeah, but and coaching, or when people come to therapy for just to do as self-pay to do self-growth work, that's more of that 0 to positive 10 range, where it's about, well, maybe I've still got stuff I want to work on and grow and be better at and do exploration in, but it's not from like the point of deficit and dysfunction. It's the point of I'm okay, but I want to do even better. So I want to get people to that okay point where they're doing well enough that they don't need therapy anymore, and have the resilience that they that you're really ready to fly, that by stopping therapy it's not going to mean falling back into that low point again, right? To really have the resilience that you can fly out of the tree and continue flying. And so anyway, that was a little sidetrack. So back to SMART goals. The goals are the SMART goals, SMART objectives are the goalposts. I usually like to set 2 SMART goals. I don't want it to be overwhelming. Don't want there to be too many objectives going on, but these are a means of going, okay, where am I at right now? Where is the client at right now? That's the baseline. And then what would be over, I usually do a 3-month period of time or so, and what would be the target of what kind of change would happen in that time? What would be an indicator that progress is being made? SMART stands for specific, measurable, achievable, realistic, time limited. That's going to be, I do these 3 months, That's how our practice has determined to do it, and I think that's pretty in line with insurance expectations as well. I think they can be anywhere 3 months to 6 months, something like that. But so we'll figure out like what would be an objective, what makes sense as a measure of that progress. Like I want to feel less depressed. That would be kind of a negative oriented goal. You want to have less of a negative emotion. It could be I want to be more active in some way. I want to be doing something more. I want to be going out of the house at least 3 times, let's say 3 times a week. Well, that might be a behavioral activation kind of goal, a goal for depression. So that would be a positive change of some kind or an active change. And you might have a baseline like, well, how much are you doing that right now? And it could be 0 times a week. And so what you want the target to be, the target in this case would be 3 times a week. And there we go. Boom, we have a SMART objective. So if somebody, for instance, was dealing with depression or maybe social anxiety, something maybe like agoraphobia, you're just feeling kind of stuck in your house, can't bring yourself to go out for some reason. Um, that would be an example of a SMART goal in that case. You might have a second goal. This could be again action oriented. It could be an emotional state sort of change. If there's feelings of depression, it could be, well, I just put like I want to feel less hopeless, or positively oriented. I want to feel more joy, more job. Oh, job, is your job going to lead to joy? I don't know. Sidetrack. And so let's say I want to feel more joy. Maybe we go with that one. Maybe we throw in both. Like I want to feel less hopeless. Well, let's rate hopeless. Well, maybe the hopeless feeling is, I don't know, maybe you rate hopelessness it's a 5 out of 10, and it's a self-rating scale. And joy, maybe the joy rating is, let's say rate joy, and maybe the joy in one's life is a 1 out of 10. And so the target, maybe we have two targets here, that the hopelessness would, let's say, reduce hopelessness to a 2 out of 10. The hopelessness goes down, and the inverse of that then is that the joy increases to, I don't need to capitalize that, increases to 4 out of 10. Like we're looking at a 3 month period. And this could be short-term depression. This could be a long-term depression. So we want a realistic sort of objective here, something where we can go and measure, go like there's some sort of progress is happening here. Now after that 3 month time, now I'll check in with people along the way. And we're going to be talking more than just the objectives, more than just the goals. We're going to be having the therapy sessions where we're exploring whatever we need to be exploring. I'm going to have interventions in mind that have to do with whatever that issue is and whatever makes sense as far as what the client is dealing with. I'll be checking it along the way because I do want the goals and the objectives to be relating, of course. What we're talking about in therapy and the goals and the objectives should be relating to each other. They should relate to the symptoms and the diagnosis that were determined in the intake. It's called a golden thread, the connection between what are the problems, the symptoms and diagnosis, what are the goals, and how the treatment is then following through with addressing all of those things. So there should be a link there between those. And so even though therapy, the topics of a session may go in various directions as people bring in the things, and well, the things that they do, at the same time, part of my job to facilitate that, good productive therapy is happening is to make sure I'm checking in with the goals and objectives, and that the interventions are working towards these things, that the topics we're talking about will relate back to treating the sorts of things and reaching those goals that have brought the client in. That's part of my job. So I think that pretty well describes my process for doing goals. I review these at about the 3-month point, assess the progress going on, see how the symptoms have gotten better, gotten worse, anything new, what's changed in that time. And then we may tweak these objectives. We may go, you know what, this wasn't even a good way to measure this progress. Maybe the objective ends up not being all that great. Maybe it wasn't a great way to measure it. So totally rewrite it and go after something new. Maybe we keep it and just tweak it a little, change that baseline, change that target, and keep it longer. Because maybe we need more than 3 months. Maybe we need 6 months to judge that. Maybe we need 9 months. And people do this in different ways. I mean, my understanding is that there's just different ways of doing this, but this is my way. So now I've shared my way of doing this. So I hope that this is helpful. You get an impression of me and how I work, and that I am goal oriented in how I work with my clients. So thanks for watching, whoever you may be, and I'm going to do more videos like this, sharing about my process, sharing my thoughts on therapy related topics and issues. And yeah, there we go. So that is how I do treatment planning at this time. If I rethink this or have some new discovery, then maybe I'll update this video, but that's where I'm at right now. So thanks for watching, and I'll see you next time.